Well, Merry Christmas to everybody. This is the first of what's going to be continuous and fairly regular videos from Washington to those that are supporting us. Great time of year. Wish I was in Oklahoma with my kids and grandkids, but our business today will keep us up here through Christmas Eve, it looks like right now. I just wanted to outline a little bit for you what we're debating and what the essence of that is. We all recognize that we have problems in healthcare in our country. They're significant. They pale in comparison, however, to the financial problems that we find ourselves in and the debt and legacy that we're going to leave our children. But nevertheless, that's what's before us right now. And as somebody who's practiced medicine for 25 years, when I think about what we need to do in healthcare, I really follow some of the principles that I was taught in medical school. And the first one is listen to your patient, and they'll tell you what's wrong with them. And that's about listening, finding symptoms, combining history with symptoms, and back and forth between a caregiver to find out what the real problem is. Because when we treat just symptoms and we don't treat disease, what we do is oftentimes make the disease worse. The second axiom is do no harm. And that is what I worry the greatest amount about what we're getting ready to do, not only to the healthcare in this country, but also to an exploding budget deficit that will certainly exceed anything that the CBO has estimated. And then the final third principle of medicine, if you've already done it once and it didn't give you the answer, don't do it again. And what we know about healthcare in this country is 60% of it's run through the government. We didn't have significant healthcare inflation before we had government-run programs. And what the bill on the floor is going to actually markedly increase the healthcare inflation in this country. So rather than really working at what the first symptom is and the first disease is, which is medicine costs too much, and we need to have a bill that brings the cost of medicine down as we expand coverage. The bill on the floor, the Harry Reid bill, does exactly the opposite of that. So the next week is going to be fraught with a lot of tension. I'm not sure that we can stop this bill. And our goal is not to just stop the bill. The goal is to stop the bill and fix the real disease and the real problems in medicine. And those most everybody knows. One is it costs too much. Number two, it's not transparent. Number three, there's not real competition between the insurance industry. Number four, liability reform needs to happen if we're going to lower the cost of health care. The critical things, being able to buy insurance and what's best for you and your family, and not moving more people into Medicaid, a system that has worse outcomes. So my hope is that we ultimately win to come back to treat the real disease of healthcare, which is lowering the cost and creating transparency and creating real competition. And I think if we do that, if we're fortunate enough to do that, then I think we can make some real healthy changes in healthcare in our country that will truly increase the access for millions of Americans, lower the cost that you presently pay for healthcare, either yourself directly or through your employer, and have a healthcare system that allows everybody access and nobody in the middle of a pinch because they have a health problem. A lot of things going on in Washington. My greatest worry is we're borrowing $4.2 billion a day now. And as you can imagine, that adds up rather quickly. We're going to have a budget deficit of over $1.5 trillion next year. We're going to borrow 45 cents out of every dollar that we spend. And quite frankly, the people in Washington don't get that. And it stems basically because they're ignoring the U.S. Constitution. The enumerated powers spell out very specifically what the role of the federal government is. And the 10th Amendment states very clearly that what's not spelled out, what the role for the federal government is reserved to the people in the states. So my hope is in the next year that we'll see a renewed vigor to go after the real problems that are facing our country. And the biggest problem is we're mortgaging our children's future by not making the hard choices in Washington. And with your help, I hope to be effective in that. I would pray that you would have a great holiday season, that we'd remember the sacrifice that this season's based on, and also the model of leadership that this season's based on, which is a leadership based on service to others. Merry Christmas to you. May God bless you, and I'll see you again soon.